May is National Trauma Month. In the studio this morning, we have Dr. Kerry Watson, who is the Trauma Medical Director for Piedmont Medical Center. And good morning to you, Dr. Watson.
Good morning. Happy to be back.
Welcome.
So National Trauma Month, what is the message that you want our audience to know specifically this month? Now, everyone can always argue, like, isn't every month Trauma Month? But like everything else, it's nice to have a moment to shine an extra bright light on. But what's the takeaway?
Absolutely. So back in the 1980s, actually was when May was designated as National Trauma Awareness Month. And the reason for that is we started realizing how much prevention and education really played a role in preventing these major catastrophes and deaths. And of course, the most common reason that people in their midlife actually die, unfortunately, is related to trauma. And so that's really where this kind of spurred this whole conversation and national kind of chance to have education for people. So here in Rock Hill, obviously, one of the things that we continue to communicate to our community is that we are a level 3 trauma center, and we get all of those types of traumas. So our most common in the area is a fall. And I know for a lot of people, you think a fall, that can't be that severe. But when we talk about fall, we're talking about fall from standing, but fall from ladders, stairs, roofs, trees. We see all of that. And that can lead to a lot of different types of injuries.
And also with it being May, people are getting ready to be outside more.
Absolutely.
Summertime's coming. So you're going to be on the boat. You're going to be in the water. You're going to be hiking the mountains. You're going, you're going to be outside doing more. And I think it's a great time just to kind of raise that awareness. Hey, it's great to do all of those things, live life, enjoy life, but
Right.
be careful.
Well, when you think about last year, even in 2023, we had right at 1,000 admissions to our facility for traumas. And that means that your injury was so severe that you required some sort of intervention. And that can be from those types of falls or injuries. That can be broken arms, broken legs. And one thing a lot of people don't realize is we have a huge initiative in our hospital to get those hip fractures. So hip fractures for the elderly population, which is 65 and older. Believe it or not, 65 is elderly. I know that hurts a lot of us, but a hip fracture, the mortality, meaning the death rate, and the morbidity, meaning the issues that can come down the road, wounds, infections, pneumonia, is it's substantial. So we have a whole initiative to get you to the operating room safely within 24 hours, and which a lot of hospitals, even trauma facilities, don't do. So that's why when we talk about when you have that fall and that injury, the reason we want you to come to our hospital is we actually have an entire structure to help get you the care you need faster.
That's remarkable. So a level 3 trauma center right here at Piedmont Medical Center. Dr. Watson, is there a certain age group where trauma is impacted the most, or those in that age category have more trauma than others?
That's a great question. So about almost 50% of the trauma we see is over the age of 65. And again, that's where we're getting a lot of those falls. But the other almost 35 to 40% is in that middle age range, that 18 kind of to 60 range. And those tend to be the higher velocity and higher impact injuries. So that's where we see a lot of the higher deaths. And so we talk about falls, but really motor vehicle collisions, so car crashes and motorcycle, that is huge. And that tends to be a lot of times the more devastating injury, where it's not just a singular fracture to a hip, but that can be head trauma, neck trauma, rib fractures, pelvic injuries. In and of themselves, each one of those injuries can actually lead to death or being in the hospital for a prolonged time. But motorcycle accidents, unfortunately, a lot of times we see a combination of a lot of those injuries together.
I'm a little surprised at the percentage in the age category. I would probably think it's more younger people because they think that they're tough and they can withstand anything. So with that being part of the discussion, when we talk about young people, typically guys take more of the risk.
Yes.
Is there a breakdown between gender, between male and female? Again, what you see most of there?
Yes, you're hitting the nail on the head. Men, it is more common for men to be involved in more serious traumas than women. As they age, women outlive men, so the population actually shifts where there's more women who come in as traumas with falls. But in that more serious category, it is men. And one of the biggest messages that I would say to our community is we have such a beautiful area, and it's great to be out and about and out on your motorcycles and traveling, but please wear a helmet. We do not have a helmet law for those who are over the age of 21 in South Carolina, and about almost 65 to 70% of our population out on their motorcycles is not wearing a helmet. And when those patients come in, up to around 70% end up having some sort of head or neck trauma. And unfortunately, a traumatic brain injury, that changes someone's entire world. And so the one thing that you can do to really prevent that from happening is wear that helmet.
Dr. Kerry Watson is the trauma medical director for Piedmont Medical Center. As she has just been describing, Piedmont Medical Center is a level 3 trauma center. So with all this information now that you shared with us, what is the takeaway? What can we do to protect ourselves? I know you mentioned briefly wearing a helmet, probably putting on a seatbelt, but what else can we do to protect us so we don't have trauma in our lives?
Great. The biggest thing is always going to be planning ahead. So if you know that you're going on a motorcycle trip that's going to be a long adventure or something like that, making sure that you're not driving under the influence, you're staying nice and hydrated, you're getting good sleep. Those are other things people don't think about on some of these long trips, is sleep deprivation and what that can do for you. The traffic out there, whenever it's summer months and people it tends to be more. So being aware of your surroundings, avoiding the distractions that can happen in your car, making sure that everyone is staying nice and calm. You don't have too many things going on in the vehicle. And then obviously when it comes to trauma, we talk about water sports. We talk about BMX is going on right now in Rock Hill. So all of that comes to safety, again, of wearing the appropriate clothing, wearing your life vest whenever you're out on boats and vehicles, water vehicles. All of that can make a huge impact of if you have an incident that does occur, because again, I'm seeing you on your worst day. These things aren't planned. Whenever you're coming to the hospital for a trauma, you didn't plan it. So if you can do the things to prevent something from going from just a minor injury to a devastating injury, that is the goal.
Given your role and in this position, do you yourself sometimes second guess taking a risk on certain activities?
Yes. Honestly, I would argue anyone who kind of sees what we do probably thinks twice about most. What I will say is, number one, I'm not a giant fan of motorcycles. If you are a rider, again, wear the appropriate equipment. If I'm ever on a boat, you will always see me in a life vest. Too many people that get thrown from a boat. It's actually not the impact, it's going under the water, and then that talks about drowning and issues like that. But I will tell you, I do love a good roller coaster. So I do love an adrenaline rush.
There's a good balance.
There's a balance there.
Well, you get a front row seat of what happens when people do not make smart decisions again, or it's just completely out of their control, wrong place, wrong time. But when you're armed with that kind of knowledge, you certainly do think twice, and that's what hopefully will happen this month. Do whatever you can ahead of time just to make sure whatever activity you are doing, you're doing it in a safe manner.